Hi, my name is Dr. Matthew Connor and I am a surgeon at Tallahassee Ear, Nose, and Throat. In this video, we are talking about tonsils. People often ask, what are tonsils and what do they do? Well, tonsils are lymphatic tissue, similar to other lymph nodes found in the neck, groin, and armpits. The tonsils are the two round lumps found on either side of the back of the throat. They are part of the immune system. They sample bacteria and viruses that enter the body through the mouth. Tonsillectomy is the removal of the tonsils. They are usually removed to relieve problems with airway obstruction or to alleviate problems with repeated or chronic infections. In cases where the tonsils are enlarged, they tend to fall back into the oral cavity, particularly when we are asleep and laying on our back. This potentially leads to blockage of the airway and an inability to get air down into the lungs. This causes an arousal from sleep, which increases the muscle tone of the throat and thus relief of the airway obstruction. When these repeated episodes of obstruction occur as one gets into deeper sleep, this is termed obstructive sleep apnea. This can potentially lead to problems with daytime sleepiness, bedwetting, severe snoring, high blood pressure, increased size of the right side of the heart, growth retardation, dental misalignment, and behavioral problems. In adults, this can also lead to problems with an increased risk of heart attack and stroke, as well as early death. Removal of the tonsils may alleviate the tendency for the airway to obstruct when sleeping and eliminates these health risks. Sometimes this is performed in conjunction with an adenoidectomy in children, and also sometimes in conjunction with removal of a portion of the soft palate and uvula, termed a uvulopalatal pharyngoplasty, or UP3, in adults. Studies have found that children with obstructive sleep apnea benefit from tonsillectomy and adenoidectomy by improved quality of life, behavioral and neurocognitive improvements, improved school performance, resolution of bedwetting, and heightened weight growth for those children with previous growth failure. Tonsils are also removed due to problems with repeated infections. The image on the right shows what your throat may look like during a tonsil infection. As a rough guideline, we consider tonsillectomy when a patient has had 6 acute tonsillitis episodes in the course of 1 year, or when they have had 2 to 4 infections per year for a number of years. Additionally, some patients may develop chronic inflammation of the tonsils due to debris lodging in the tonsil beds themselves. Patients are also given consideration for a tonsillectomy when they have had abscesses form around the tonsils. For patients with recurrent infections meeting these criteria, studies demonstrate improved quality of life and significant reduction in the number of sore throats after tonsillectomy. Some patients ask, will removing the tonsils harm my immune system? There are no studies to demonstrate a clinically significant impact of tonsillectomy on the immune system. There are many other lymph nodes in the body that compensate. Additionally, with chronic or recurrent infections, the tonsils become so overwhelmed with persistent stimulation that they are unable to respond appropriately and no longer function adequately. Therefore, there is an advantage to remove recurrent or chronically infected tonsils. Removal of the tonsils is a very common procedure, but not without some risks. There is a 2 to 3% risk of bleeding following the tonsillectomy. Because of the risk of bleeding, we recommend that patients who undergo tonsillectomy take no aspirin for at least 10 days prior to the surgery and take no ibuprofen products for 4 days prior to the surgery unless otherwise directed by your surgeon. Aspirin products should also not be taken for 2 to 3 weeks after surgery. Acceptable pain medications include acetaminophen or the prescription pain medicine given to you by your surgeon postoperatively. Your surgeon will determine whether or not ibuprofen products may also be used after surgery. We also recommend that anyone who has had a tonsillectomy avoid strenuous activity, heavy lifting, and straining for a period of 2 to 3 weeks following the surgery. However, most patients are able to resume work or school in light activity within 7 to 10 days of surgery. Some patients also note a transient change in taste and a change in the sensation of the tongue area. This is thought to be due to pressure on the tongue during the exposure of the tonsils for the surgery. There are patients who, because of their size or anatomy, are less capable of handling any potential complications of the surgery. We are especially careful with these patients and like to keep them in the hospital overnight for closer observation. In particular, we like to keep children who are less than 3 years of age and who are being treated for severe sleep apnea in the hospital for closer observation. Before the operation, please let your doctor know if you, your child, or a family member has any history of easy bleeding or easy bruising or any problems with anesthesia. So, what to expect on the day of surgery. You will usually arrive an hour or so before the procedure actually begins. If your child is having the procedure, it is a good idea to bring a book, toy, or movie. Children will be given anesthesia by way of a mask and safely go to sleep. Once asleep, an IV will be placed, and then your child will completely go to sleep with a breathing tube. While carefully positioned, the surgeon will remove the tonsils through the mouth and then stop any bleeding. You or your child is then carefully awakened and the breathing tube is removed. The surgeon will then come talk to the family in the waiting room to let you know how everything went. After surgery, it is important to stay hydrated. Ample fluid intake, which is 6 to 8 8-ounce glasses per day, helps prevent dehydration and constipation, which is a common side effect from narcotics and anesthesia. You may advance to soft food as tolerated. Avoid hard, crispy foods like nachos or pretzels because they can scratch the throat and lead to bleeding. Other things to note are that citrus juices, carbonated drinks, and hot fluids can cause pain. You will experience a sore throat and in some cases an earache. The earache does not mean that there is an ear infection. It is a normal part of the recovery from surgery. You may also expect a low-grade fever. The discomfort usually lasts 7 to 14 days. There may be variation in pain from one day to the next, and this is normal. We hope that this video has helped you to understand the risks and benefits of tonsillectomy and what to expect during your recovery. If you have any further questions or concerns, please contact our office at any time.